Good morning, everyone. Happy Borough Board Day. Happy almost end of May. Memorial Day coming up really quickly. And I just want to thank all of you for being here today. Um, we're going to start out as we usually do with our roll call. I will say each community board and or council member representative, and please just unmute yourself and stay present so we'll know that you're here. If you can give us your image, that would be great as well. So we start as we usually do with Community Board 1.
Hey, Brian.
Okay, Community Board 2.
Good morning, Madam Deputy. Good morning, everyone. Happy Thursday. Ralph Acevedo, District Manager, Board 2.
Thank you so much. I love that energy. Always do. Thank you for that. Community Board 3.
Good morning. Good morning, Madam Deputy. John Dudley, District Manager, Board 3, present.
You still here?
Yeah, this is it, though.
It's his swan song today.
Oh, my goodness.
This is the last time we would have the privilege and the pleasure of being in the presence of the ultimate.
Stop.
Mr. John Dudley.
Rep.
This is
That
Dr.
is true.
Bruce Rivera, Board 3.
Thank you so much.
Thank you,
Truer
Rep.
words have never been spoken. Community Board 4.
Good morning, all. Robert Garmendes, CB4.
Thank you. Community Board 5.
Good morning, everybody. This is still Ken Brown, and I'm still the District Manager of Board 5.
Okay, thank you. Community Board 6. Okay, giving a little bit of time to unmute Community Board 6 again. Okay, moving along, Community Board 7.
Hello, everyone. This is Emmanuel, Chair of Community Board 7.
Good morning, Community Board 8.
Good morning, everybody. Laura Spalter, Chair, Community Board 8.
And good morning. This is Kira, District Manager.
Good morning to both of you ladies. Community Board 9. Okay, Community Board 10. Okay, Community Board 11. I hear a little bit of noise, but I don't hear anyone from Community Board 11. So moving to Community Board 12.
Hi, this is George, Community Board 12.
Thank you, George. Our first council member representative from Council Member Ayala's office.
Good morning, everyone. Jose Rodriguez from Council Member Diana Ayala's office. Good morning, and good morning.
And good morning. Council Member Denowitz's office. Council Member Riley. Council Member Jonai. Council Member Cabrera. Council Member Felix. Council Member Gibson.
Good morning, everybody. Reshma from Councilmember Gibson's office. Hope you're all well.
Oh, thank you. Thank you for answering. I was beginning to think I was talking to myself. Council Member Salamanca. And last but not least, Council Member Diaz Sr. Okay. Marisol, are we good?
Yes, ma'am.
Okay. Of course, now leaving room for technical difficulties. I cannot, for some reason, pull up my agenda. Give me 1 second, please. It's not it. Okay. Good morning, everyone. Again, I am Marika Scott McFadden. I'm the Deputy Borough President. Pursuant to Chapter 4, Section 85, and Chapter 69, Section 2706 of the New York City Charter, a joint meeting of the Bronx Borough Service Cabinet and Bronx Borough Board will take place on Thursday, today, May 27th, 2021, beginning at 10 a.m. via our virtual conference, Zoom today. And I want to thank you all for being here yet again for yet another meeting and yet another month of the pandemic. Thank you. So we're going to start out, we're going to jump right into our agenda. We're going to have an overview of Project Hope, COVID-19, and we're going to have that presentation from the director of New York Project Hope, Department of Health and Mental Hygiene, and we're going to have Alex A. Gomez. Alex.
Thank you, Deputy, and thank you all for having me here this morning. I appreciate the opportunity to speak with my fellow Bronxites. I've grown up in this community and have a lot of love for the Bronx. So I just want to go right into the presentation. Again, my name is Alex A. Gomez. I work for the New York City Department of Health. I am the project director for New York Project Hope. I'm going to share my screen so that we can see the beautiful presentation. Just confirm if you see it on your end.
Yep, we can see it.
Okay, great. Thank you so much. Just trying to expand it so that we can. Oh, great. So New York Project Hope, and I'm sorry about the wrong information at the top, but New York Project Hope is a response to the COVID-19 pandemic. New York Project Hope started in the governor's office last year around March 2020. New York Project Hope is a FEMA-funded program. This is probably the third iteration of New York Project Hope. The last two were New York Project Sandy, right after Hurricane Sandy, and the one prior to that was Project Liberty after 9/11. So how did it start and why are we here? Well, the pandemic brought on a lot of difficulties for New Yorkers. We were all affected by the COVID-19 pandemic, directly or indirectly. A lot of us were stuck at home with no access to our friends or families, and there was a lot of confusion, stress, emotions, feelings that individuals were having a challenge dealing with. So again, the governor's office created a helpline for individuals to call in to speak with someone about their feelings, their emotions, their worries. And this was a project that was moved over to the Office of Mental Health in June of 2020. In September of 2020, OMH contracted the New York City Department of Health to provide these services across the 5 boroughs. So New York City has taken on the responsibility of implementing these services across the 5 boroughs, and we've contracted 21 providers. Over the last 6 months, our providers have been providing services to deal with some of these feelings that individuals have found themselves dealing with on their own, stress, anxiety, isolation, feeling scared, angry, and sad, and not being able to express or speak with someone who can help them sort out these feelings and be able to find solutions to some of the situations or issues that come up or have been part of this pandemic. And Project Hope is really a helpline and also services both virtually and in person to help individuals deal with the pandemic, deal with their emotions, deal with their feelings, with their I would say depression. So the emotional support helpline is available between Monday and Sunday, 8 a.m. to 10 p.m. It is available to every New Yorker, regardless of immigration status, regardless of age. We serve children, youth, young adults, and seniors across the city. These services are also available across the state. The crisis counselors that pick up the phone calls are trained individuals or paraprofessionals. They're not social workers. They're not. This is not replacement for traditional mental health services. These individuals are trained to deal with a crisis. They're there to hear you out, to listen to what's stressing you out, and work with you to come up with a plan. Do some breathing exercises or help you with other types of techniques that would help you deal with your feelings. The services, again, are free, confidential, available 8 a.m. to 10 p.m. Monday through Sunday. So I'm going to give you the number to the statewide helpline, but each of the providers in New York City are providing their own services individually, and they all have set up a dedicated helpline. In the Bronx, we have around 6 providers who are providing these services in much needed areas. The Bronx was one of the hardest hit by the pandemic, and still is. So our crisis counselors are also available to do or provide these services in person. You might see them out in the community, tabling an event, providing counseling right in the streets of the Bronx. Some of these services are going to be available throughout the summer at schools, community parks, and anywhere we can socially, physically distance and provide services to individuals who need these services. Our providers are also going to be doing group sessions, educational workshops on different types of, again, information supports techniques to deal with stress and deal with your feelings. These workshops will also be virtual. The providers that are working with us are providers that have been in our communities for years. They know our community members. They can offer linkages to community services, whether it's connecting someone to a food bank, connecting someone to an attorney for eviction prevention, connecting someone to job placement services, or just connecting someone to a therapist. If someone calls in after 3 sessions, there's an assessment referral tool that is used both for children and adults in order to determine what type of services these individuals need. The calls can last as long as the individual wants. They don't need to give up any information. It's all confidential. We don't track who's called us, but if they identify that they've called more than 3 times, we do provide those services where we can refer someone to intense mental health services or connect them with a therapist in the community. Our website is full of information. You can even click a button on the website and it'll connect you to a crisis counselor. If you go on our website, I'm going to show you how to look for a provider right in your backyard, nyprojecthope.org. Again, here to talk, here to listen, here to support. It's available 24/7. There's tons of resources on that website. Our social media handles are nyprojecthope. Again, this is not a replacement for traditional mental health services. We always recommend individuals to contact their insurance provider or to ask for a list of in-network providers or speak with their primary care physician. And that's important. We do want to connect people to the right services, but at the same time, these crisis counselors are prepared to listen and are prepared to come up with a plan with each individual that calls in. They're supported, educated, trained individuals who can understand and help individuals with their reactions. They can help individuals regain a sense of mastery and control, and they can help people make decisions and make a plan and learn how to manage their stress. These phone calls are not monitored, but they are, again, we do not capture any information from anyone. So if you are undocumented, it's okay. If you are 5 years old and you want to call and a parent is giving permission, that's okay too. If a parent wants to call with their spouse or with their children, they can do a group therapy session or crisis counseling session right over the phone. So individuals are assessed depending on what they've said, and then a referral is made as needed. Again, these services are also available in person. We are not therapists, we're not social workers. These are individuals who are trained to connect individuals to these services in their community. Again, we are on social media, Instagram, Twitter, Facebook. If you want to follow us or retweet us or connect your friends and families or your communities, please follow us at NY Project Hope. We do have a flyer and brochure that I can share with you all after this meeting, and you can, again, share it with your community members. Again, the support line is the number that you see on the screen, 844-863-9314. That's the state helpline. And individuals can call that number anytime between 8 a.m. and 10 p.m. If you call that number, they can connect you to someone in your neighborhood or in any neighborhood across the 5 boroughs. And each provider is available as well. If you go on our website, you can click on at the bottom, it says, what county do you live in? So if you put the Bronx, you can see all of Bronx providers. But on your screen right now, you can see all of the different providers across New York City that are providing some of these services. These are their dedicated phone lines. We, again, are providing these services in all languages. So even if you don't speak the language that our crisis counselor speaks, they will connect you with someone or get a translation line assistance so that we can help and assist you in your preferred language. All of our paperwork is also in multiple languages so that we can assist individuals in the language that they speak. Resources are available on both on the website and by calling the support helpline. And if you want a presentation like the one that you're hearing today, you can definitely connect with me. And I can do another presentation to your specific community board, or if you're working with a council member, to your council member's constituents, I'm available. We can make that happen. We are also providing these services in schools. So some of these services include workshops. We work with the parent coordinators, the guidance counselors, and social workers in the schools to make sure that these services are out there for parents to use, for children, for the students, for the paraprofessionals, for the teachers, for the administration at the schools, and just for the community at large. We want to make sure that everyone gets these services both in person and virtually. So we are providing support at PTA meetings, at recreational activities. We do mindfulness exercises and coping techniques. Again, on behalf of the New York City Department of Health, I want to continue to encourage you to prevent the spread of COVID-19. You all have seen this before, but for more information, you can follow the directions of the CDC and the New York City Department of Health and Mental Hygiene. And lastly, vaccine distribution and information, you can go to nyc.gov/COVID vaccine. Thank you. Again, thank you for allowing me to speak about New York Project Hope. I do want to, encourage you to share this information. It's vital. It's free. It's confidential, and it's available right now across the 5 boroughs. This is funded through, again, FEMA. We are providing these services both in person and virtually as needed. So if you have any questions, feel free to reach out or call me or email me, and we can set up another presentation or provide you further information. And I can take any questions if anyone has any questions about our services. Again, thank you so much.
All right. I do see one hand raised. Deputy Ken, CB5. So Ken, go ahead.
Okay. Thank you very much, Alex. It's always nice to hear from you again. If you don't mind, I'd like to unpack the referring that Project Hope does. In particular, when someone calls in and a recommendation is made for a referral to outpatient services, what actually happens during the referral? Will the operator on the line vet the referring source for appropriate health insurance? Can Project Hope be used to help people that have billing problems, help them apply for health insurance? And are you able to refer to resources that are not exclusively mental health, but ancillary, like substance abuse and physical health?
Sure. Great question. Thank you for the question. Yes, crisis counselors are ready and prepared to use a referral tool, an assessment referral tool, to provide referrals to multiple services, including other services outside of mental health services. The referral is also, or the person speaking with the individual will assess if the person has health insurance and if that's something that needs to be addressed before the referral is made. Again, we don't track this information. We don't keep that person's information on file. This is not case management, but we do make the connection. So we hand people off. Some of our providers are already providing some of these other services, including services to undocumented individuals. So if someone doesn't have mental or health benefits, they can be connected to someone who can help them connect to those health benefits in order to then be able to see a provider who either provides them mental health services or other types of health services. I hope that answered your question.
No, thank you, Alex. No, what I wanted to know in particular is when a referral is made, say, to an outpatient psychotherapeutic provider, will the operator, the referral from you, include vetting that service for appropriate, that they accept the client's health insurance?
Sure. Yeah, we don't refer, 9 out of 10, we don't refer anyone unless we've already vetted these services. So our providers are working with local health clinics and mental health services, as well as other types of health services in their communities, because they know their community. So they're working in partnership with these clinics and doctors so that these services are the right services for those individuals that are calling in. So they are vetted. But we, again, each provider has different services. Some of them are in-house, some of them are referred out.
So I'm sorry, this is the last one and then I'll stop. So when a referral is made, and let's say I'm calling in and I have Empire Blue Cross, when your operator refers me to Dr. Smith, they'll know that Dr. Smith takes Empire.
Sure. I mean, and I think that's a very important question. Yes, our crisis counselors are working closely with the individuals calling in to make sure that the connection is the correct connection before the exchange is made. So they will work with the individual to make sure that the referral is appropriate and that their health insurance is going to be accepted and that the location is even accommodating to them, because it might be too far, it might be too difficult for someone to get to a certain location. So those are all things that are considered. This conversation is happening between the crisis counselor and the individual calling in.
Yeah, thank you, Alex. That's a really robust, warm handoff. Thank you.
Additional questions?
Yep, sorry, Laura Spalter. I see your hand raised. Go ahead.
Oh, I was wondering, do you have data on how many participants have used the service?
Sure. I can pull up our latest data report, and I can tell you as of this morning, give me 1 second while I pull that up. And I'm looking at our service delivery report that just was released this morning. We've had a total of 10,676 individuals served. We've had 8,319 family encounters. We have served individuals across the 5 boroughs. Total participants served are 13,831. And we've had 1,140 group encounters. Again, these services are across the 5 boroughs. We have been providing services since the middle of February, but the program itself has been or across the New York State has been in action since September of last year, but here in New York City since the middle of February.
Thank you.
So these numbers are reflective of that time period.
That's impressive. Do you have any inkling of whether this will continue to be funded by FEMA?
Yes, we are in the process of a no-cost extension that is being, at this moment, negotiated with FEMA through OMH. OMH is the contractor with FEMA, and we're the subcontractor. And there's a 99.9% chance that it's going to get approved. FEMA has told us that we should be able to continue to provide these services through the end of this year. But we will get that notice in the next 2 weeks. So we have informed all our providers to continue to provide services moving forward through December 15th.
Thank you.
Thank you.
All right, John Dudley raised his hand. John, go ahead.
Yeah, good morning, Alex. Alex, I want to take an opportunity also to thank you, because I understand you came and made a presentation to our Health and Human Services Committee here at Community Board number 3. So, and Etta also wants to thank you along those lines. I just got a question. How do you measure? I know you have the report, the service delivery report that gives data on the number of individuals and families that have received assistance through this program. How do you, in general, then measure the success of it? Do you measure the success just based upon the number of people entertained and the referrals to other resources or support services? How do you actually, in other words, is there any way that individuals that avail themselves of this service can respond back to the extent of saying that it helped them in any?
Sure. So thank you, John. And we've met before in person. I think about 8 years ago, I was introduced to you by Rosemary Ordonez Jenkins when I was working over at Phipps. So it's been a while. But I can answer your question by saying, yes, we track different aspects of the data. Right now, there's a survey that is being put out to all of the individuals who are receiving these services, and we're requesting feedback. So we'll have that data hopefully before the end of the summer. We're going to do another survey again towards the end of the summer. We capture also the event reactions or the reasons why people are calling. So that's how we're also engaging the success of the program. Are people using these services for the right reasons, or what are the reasons that are making individuals connect with our services? We also see an increase in calls every week. So that's how we can also measure that the success of the program. And we're also capturing again the referrals that we make and what were the reasons for those referrals. So once we get that survey data back, we can definitely share that with the public, and that's our intention, to find out why this program was successful and how we can improve it moving forward.
Good. And that, let me ask you, that's part of the requirement contractually? Because I know you said federal money goes to this New York State Office of Mental Health, and in turn, they subcontract with the New York City Department of Health and Mental Hygiene, who then contracts the providers. The providers, 6 providers, you're saying they're in the Bronx? I know there are about 21 overall in the city, but there's 6 in the Bronx.
There's 6 providers. They're not all physically located in the Bronx, but they are providing services in the Bronx. There are providers that have offices based in Queens or Manhattan, but they're providing services in the Bronx. So yes.
Okay. All right. Okay. So let me just ask you this, and I'll just go. So in other words, all the providers citywide, do they provide services
Citywide.
in boroughs? They provide services
Correct.
citywide. Okay.
Correct.
All
And
right.
when I mean that those 6 particular providers provide services in the Bronx, that means that they're physically coming out to the Bronx to table events or to go out into the streets to give out information or to do actual sessions,
Right.
whether it's in a park, a public place, anywhere we can sit and speak with the public, we have providers.
Okay. And just lastly, will the service delivery report also provide data with respect to how many people? In other words, if there's an overabundance of individuals that are using this service that are coming from the Bronx as opposed to Queens or any other borough, so we can get a sense citywide as to who's being most affected to the extent that they reach out to you. Okay.
Yes. Yeah, we do have that information, and I would say that the Bronx has been using the services quite a lot.
Quite a lot? Okay, good. Thank you, Alex.
Yes.
You're doing a wonderful job. Thank you so much. Okay.
Thank you.
All right, I don't see any. Oh, nope, I do now. Reshma just raised her hand. Reshma, go ahead.
Thank you so much, Alex. I just had a brief question for you. I know you said you made a point of that this is not case management and you don't keep any documented cases. But I was wondering if you're working with minors and they reach out to you for a mental health issue, but then you find out that they're in an abusive situation or they need emergency assistance. Do you call in the NYPD or some kind of enforcement unit then, and then do you follow up with them to make sure that they're safe afterwards? Like, how would that work if it's an emergency situation?
Sure. If any of our crisis counselors happens to get a call from an individual or child or a minor who is in a difficult or abusive situation, the crisis counselors are trained to identify that, but they themselves would seek out a supervisor or a social worker that works within their organization who's going to intervene and provide those services. And if they need to make the referral to ACS, they will make the appropriate referral, or they would call 911 as needed. So they're trained to handle those type of situations. If they hear that that from their conversation with the child or the minor, that's what's needed. Yes. Thank you for the question.
So the minor or the child or whoever's in this dangerous situation is ensured that they are safe, like they are removed from that situation.
Correct. So that, yeah, every one of our providers has licensed clinicians who can step in if needed. Although the program is not intended to serve that type of population, but if we do identify a situation, we do have individuals who can step in and provide those services right away.
Thank you so much.
Thank you.
All right, I believe that is all the questions.
Thank you. Well, I appreciate the time, and I will share with you all again the flyer and the brochure so that you can again share it with your communities. And thank you so much for this opportunity to share with you about New York Project Hope. Have a great morning.
Thank you, Mr. Gomez, for your presentation, and thank you all for your great questions. We'll continue with our program, our agenda, and we'll have an overview of the e-scooter program from the Department of Transportation. I don't have the name of the person who will be doing the presentation, but please introduce yourself and tell us about the e-scooter program.
Good morning, Madam Deputy. Good to see you and good to see everyone today. Just a brief introduction. My name is Navardo Lopez, Bronx Borough Commissioner. I'm here joined by
I would have said friend to the Bronx.
Thank you.
Navardo Lopez. I wasn't aware you were doing the presentation, so thank you.
Well, I'm just introducing everybody. I'm going to turn it over to Lily Gordon-Coven from our bike share unit, but I also want to introduce Jesse Cabrera and Brian Lee, who are also from the bike share unit, and also Teresa Cruz, borough planner in the Bronx Borough Commissioner's office. So Lily's going to talk today about bike share, not bike share, the e-scooter pilot. We've spoken to several of the community boards already. Boards 10, 11, and 12, which will be the first community boards in the Bronx receiving e-scooters later this year. But we're going to have a presentation. Lily's going to walk through it. And we definitely want everybody in the Bronx to be aware of what's going on, even the locations that may not be getting e-scooters this year. So with that, I'm going to turn it over to Lily, who's ready to go through the presentation.
Thanks, Navardo. I'm going to share my screen. Okay. So thanks again for having us. My name is Lily Gordon-Coven. I'm the director of dockless pilots in the bike share group at DOT. Our group has historically overseen City Bike, which many of you are now familiar with since we've begun expanding into the Bronx last year, but we are also now working on additional forms of shared use mobility, including e-scooters. So I'm going to walk through a presentation and talk about sort of how we got here and what the pilot's going to look like. So just so we're all on the same page, we know there's a lot of, there can be a lot of misunderstanding of of the term scooter. Can be kind of an umbrella term. So we're talking about the type that are in this photo here, which is defined in state law as a device with a handlebars, a floorboard, and/or a seat, and an electric motor. These vehicles are not registered with the DMV. You do need to be 16 years old to ride one, however, and the state law limits the speed limit on these vehicles to 15 miles per hour. And really importantly, riders should be operating these vehicles in the same manner that they would operate a bike. So that means you can ride in a bike lane where one is available, and if not, ride in the travel lane, should not ride on the sidewalk, obey all traffic laws, and yield to pedestrians. Escooter Share is similar to bike share. It's a network of shared e-scooters intended for point-to-point transportation. So less intended for recreation and exercise, well, I guess not exercise in the case of e-scooters, but more intended to get you from point A to point B. It's a form of increased mobility, so it really just adds to the transportation options we already have in New York City. We think it's going to be particularly convenient for providing connections to transit. And unlike City Bike, unlike our dock bike share program in New York City, these scooter shares are dockless and free locking, so it really limits the infrastructure needs and can be more flexible. So we got here over the last couple of years. Many of you may have seen e-scooters in other cities around the country. E-scooters just became legal under state and local law last year, and City Council mandated that DOT conduct a shared e-scooter pilot. So last year, we released a request for expressions of interest for a dockless e-scooter pilot, and we evaluated responses based on the company's experience, safety, operations, accessibility, equity and outreach, and consumer and labor policies. In February, we announced the East Bronx as our pilot zone. And then in April, we announced the 3 companies that will be participating: Bird, Lime, and VO. This is a map of the pilot zone. It's essentially everything east of the Bronx River. And we expect to begin in this phase 1, this orange-yellow area in the northeastern Bronx with 3,000 scooters. We're also working with others at DOT and targeting additional bike lane infrastructure projects this year to really beef up the bike network in this area. Assuming that the first year of the pilot goes well, we will expand south into the southeastern Bronx in our phase 2 area, and we would add about an additional 3,000 scooters in this area. So in total, we'd have 6,000 scooters in this second year. And we're also working on additional bike lane projects in the southern area so that hopefully there's some more infrastructure there before the pilot arrives. And then I guess just one other thing I'll point out on this slide is that you can see the city bike expansion area sort of at the edge of this map in blue. So I know many of you are familiar with that work, and we're happy to answer questions about that as well. So some of the key program elements, these are the vehicles that we'll be seeing as part of the pilot. I know there's a lot of privately owned e-scooters out there right now on the streets, but these are the vehicles that will be involved in our pilot. So available for shared use, not for private ownership. So the Bird vehicle, the Bird 3, the Lime Gen 4, and then 2 vehicles from Vio, the Astra Standing, and the Cosmos Seated Scooter. So the Cosmos Seated Scooter, you can see kind of in the background, it looks a little bit more like a bicycle. And we're interested to see how people use this vehicle in relation to the other forms, the standing form. We've heard from other cities that, maybe older folks, people that maybe are running errands, might prefer a seated vehicle, and may prefer this for longer trips. So we're interested to see how that plays out. And then the other thing I'll note is just that these are really the latest models. So many of these companies have been iterating a lot, and you can see that from the names of the Bird 3, the Gen 4. And so we'll be the first market to get some of these vehicles, which is exciting. So riding one of the e-scooters is fairly straightforward. Users will download the app to their smartphone, register with a photo ID and payment information, and then take an in-app safety training and quiz. We'll talk a little bit more about that in a minute, but it's really important to us that people understand how to use these vehicles, how not to use them, especially because not only is this the first Scooter Share program in New York, but scooters just became legal. So they may be a new vehicle to a lot of people. So you'll find an e-scooter in the app. You can see this image showing a map of where scooters are located in your area. And then you'll unlock the e-scooter by scanning a QR code on the vehicle. And then, as I mentioned, ride the e-scooter as you would ride a bicycle. To end your trip, you'll park in one of 2 ways, which we'll talk about in a second, and then you'll follow the in-app directions for locking the e-scooter. This is a screenshot from the Vio app. You can see you're asked to take a photo of your scooter at the end of the trip. And this is really just a verification that you've parked correctly, but also then, making sure that whatever happens afterwards, if I park my scooter and then someone comes along and moves it somewhere that's not an appropriate place to park, I have the verification that I parked correctly. So there's a couple of different operating restrictions that we can add throughout the course of the pilot to really adjust to the local needs of the community. So the first is a slow zone. This is a bounded area within the service area where e-scooter speeds are capped below the typical 15-mile-an-hour speed limit. No ride zones, also areas within the service area where scooters can't be ridden and the motor will cut off, slowly decelerate when the vehicle crosses that boundary. This is also what will happen if you try to ride outside of the service area. So if you tried to ride into Westchester, or if you tried to ride to the West Bronx, the scooter motor will cut off and you'll decelerate. You won't be able to use the vehicle anymore, but you would still be being charged for it. So you're sort of incentivized to bring it back to the service area. And then temporal restrictions, so limiting to overnight riding or restricting riding during inclement weather, all things that we can make for short-term restrictions. The pricing of the scooters is fairly similar to it's a similar model to riding in an Uber or Lyft, a taxi. So there's a $1 fee to unlock the scooters, and then you'll pay either 30 cents or 39 cents per minute, depending on which vehicle you're riding. And then, so the longer you ride, the more expensive the trip is. All 3 companies have discounted programs for low-income New Yorkers, targeting especially people that live in NYCHA and receive SNAP benefits, but also some other folks that are eligible. And these are really going to greatly reduce the cost of using the scooter. So we're really pushing to make sure that this information is out there. People who are eligible are able to sign up and take advantage of the program. So safety is really core to everything we do at DOT, and this is no exception. As I mentioned, the in-app safety training and test for new riders. There will also be a beginner mode, which requires that a user's first 30 minutes of trips are limited to 10 miles an hour and can't occur in darkness or overnight. So we want to make sure that people are really comfortable using these vehicles. You're it's essentially having a little bit of training wheels as you're getting started. Companies will also be giving away free helmets and or discounted helmet vouchers for local bike shops. Helmets are not required as part of this program, but strongly encouraged. And in addition, the companies will be holding voluntary in-person lessons and trainings each month. You can see a photo of that here from pre-pandemic times, again, trying to really get people comfortable with how to use these vehicles. It is a really different animal than riding a bike or even using one of the sort of kids' kick scooters people may be familiar with. So we want to make sure people really understand what they're doing, feel comfortable before they're out there on the road. The companies will also be creating rider accountability and account sharing prevention policies. These are really designed to make sure that we are encouraging good user behavior. So if you are breaking the rules of the pilot and the rider accountability policy, you may end up being suspended or removed from the platforms. And then the account sharing prevention policy is really to make sure that if I'm the person that's registered, I've taken the safety training, I'm the one that's using the vehicle, that I'm not unlocking a scooter for somebody else, particularly someone who's under the age of 16 or of 18 in this case. And then in addition, the companies will be creating community reporting tools. And this will enable members of the public to report improperly parked scooters and dangerous rider behavior without signing up for the programs. Accessibility is also really key to us for this pilot. We want to make sure that these vehicles are available to all New Yorkers that want to use them. So the companies will be required to provide wheelchair accessible vehicles throughout the pilot, and we're working with them on the details of what that will look like. A lot of these will be wheelchair attachments, which will essentially turn a manual wheelchair into a motorized wheelchair. And we'll be meeting regularly with the companies to talk about accessibility issues with our colleagues at the Mayor's Office for People with Disabilities. So lastly, for this section, consumer and labor protections are really important to us. We have designed the contract to protect riders and workers and promote safe operational practices. The vendors will not be permitted to include binding arbitration or class action waiver provisions in their terms of service. And the companies must use W-2 employees for their operations. No gig labor or franchise agreements will be permitted. So all of the work that's done as related to the pilot, from the back-end data work to the folks putting out scooters on the street, will be done by W-2 employees. Just briefly to talk about the parking model. So we're going to start with a hybrid approach to parking, where riders follow different rules depending on where they are in the service area. So the two main forms of parking are free-floating parking and mandatory corral zones. So for free-floating parking, this really helps us to maximize the flexibility. And this is what most of the pilot area will be. Most of the pilot area will be free-floating parking, where users will park their e-scooter on any sidewalk in the furniture zone, which is the area you can see highlighted here in yellow, so the area adjacent to the curb. And when parking in one of these free-floating zones, users must not block the pedestrian path of travel, including any ramps, block driveways or curb cuts, and must not park in the roadbed or on private property. The operators will be required to respond to improperly parked vehicles very quickly, and user or folks out in the community can let the companies know about this by calling customer service numbers printed on all of the scooters, using the community reporting features that I talked about before, or calling 311. So in a smaller section of the pilot area, we will have mandatory parking corrals. And the parking corrals will help us to minimize sidewalk clutter on busy corridors. So in these areas, you will be required to bring your scooter to a designated parking corral in order to end your trip. The corral locations are being planned by DOT and installed, paid for, and maintained by the scooter companies. And we plan to launch with about 90 corrals on some of these key corridors, which you can see highlighted here. So White Plains Road, Bronx Boulevard, Westchester Square, and then we're working with some stakeholders, including Jacoby Medical, Co-op City, and the department and the Parks Department on additional corral locations. We are going to be accepting input on corral locations through our website throughout the course of the pilot, and we expect that this is going to be sort of a work in progress as we get a better understanding of where people want to be riding and what the pilot really is looking like. These are some images of what the corrals will look like. So pretty straightforward, just basically white boxes of paint with the logo on the inside, either on the sidewalk or in the roadbed. So we are working towards our launch, hopefully in late June or early July. We've been doing a lot of stakeholder outreach, working on the corral plans, and we'll be looking to install corrals probably a couple of weeks before the pilot launches in June. And then, as I mentioned, launching with 3,000 scooters in the end of June, early July, and conducting additional outreach after the pilot launches. So that's the presentation. Happy to talk more in depth about anything or go back to any slides. I'll turn it back to you.
All right, I do see one hand raised at the moment, George Torres. George, go ahead.
Hey, thanks, Chris. Thank you, Lily. DOT did present this at Community Board 12, and we thank you for that. I think I raised the issue in that meeting, and I'll raise it again today. And I think you've spoken to a lot of it. My concern has always been with the parking of the e-scooters, especially when it comes to residential neighborhoods. When DOT sort of gave the pilot for the jump bike program, which was different than the city bike program, those individuals who were, I guess, renting or whatever with the bicycles would leave them in front of homeowners' homes, which became a nuisance for some homeowners. I mean, some homeowners didn't necessarily care one way or the other, but I would get phone calls from people stating, oh, there's a red bicycle in front of my house. What am I supposed to do with this? I know that you're for the pilot, you're doing corrals, which I strongly encourage. But I encourage that for the duration of the whole program, because again, the idea, even though the person is supposed to park a scooter sort of perpendicular to the curb and on the sidewalk, I can just imagine that if you park in front of somebody's house and they have a particular pet peeve, they're not going to take too kindly to the idea of someone leaving a scooter, especially if it's a neighbor. Like, let's just say the neighbor's child, millennial kid rented an e-scooter to take it home from the subway station, but they left it 3 houses down so that they weren't leaving it in front of their home. Somebody's not going to take too kindly to that. So again, I don't know what can be done to that, but I just see this as a problem because we had this issue, especially in residential communities where you have private homes. The photos that you have here are of buildings, multi-story buildings, where stakeholders don't necessarily take ownership of the sidewalk. So you have the furniture zone. Homeowners are very responsible for their sidewalks because they get summons from DSNY for every little thing that happens, even in the curb. So people are very territorial about their sidewalks. they don't want anybody leaving anything, especially when it comes to parking. If you leave a scooter in front of the passenger side door, or the driver's side door for that matter, people are going to be particularly upset, especially since that is the furniture zone. So again, those are my issues. The only other thing that I will say about White Plains Road, especially in my neck of the woods and Bronx Boulevard, our sidewalks are not very wide. The sidewalk that you're showing here on slide 17 looks like a 15-footer. I probably have one paver, maybe two paver of sidewalk. So if you're building corrals on the sidewalk, that's going to make it tight, especially in a commercial district like this, where you have 99-cent stores and the grocers, putting their stuff out into the street beyond the 3-foot mark. It's going to make it very, very crowded. Again, we are very supportive of e-scooters. We voted in favor of it. So I'm not saying I'm not trying to discourage this program. I'm just saying I think we need to really talk through and be mindful as you launch this pilot, like how to address those things as the complaints come in.
Yeah, I think some really good
before
points.
you answer, I'd like to just quickly piggyback off of George's comments, such that maybe you can answer the question that I have, which is you've given a lot of information about. You can call 311. You can do all these things. You can even call the respective programs. But then what happens? So my question is, if somebody calls, what happens? Does someone specifically come and pick up that bike where it has been parked in a bad spot?
Yeah, so I'll start with that and work backwards. So the companies are all that we have service level agreements as part of our contract. And so there's different requirements for different types of infractions or different types of issues. But let's say there is a scooter that is blocking your driveway. You see the customer service number on it, you call them. They have a window of time for which they can come and pick that up. And then if they exceed that window, they start to accrue liquidated damages. So they start to be fined.
What's the window of time?
So it varies. So for our first priority really is around ADA access, making sure that scooters aren't blocking sidewalks or aren't blocking the path of travel and pedestrian ramps. That window is 2 hours. And then for scooters that are just sort of, to George's question about like, there's a scooter in front of my house, I don't want it there. All the scooters need to be moved or relocated at least every 24 hours. So every day that a scooter should be moved. If there's, and these aren't.
I'm sorry, the scooter should be moved every 24 hours by the company, or you're saying the person who has leased it has to move it every 24 hours?
No, so by the company. So the users are likely only going to be using these for short trips. So I might ride one for 10 or 15 minutes, then I park it and I'm done with that scooter. You might come along 20 minutes later, pick it up, ride it somewhere else. So it's not a leasing model per se, it's a short-term rental. So once I'm done with my trip, I've parked it, I've taken that photo showing, hey, I parked the scooter correctly, I'm done. The companies are responsible for making sure that the scooters are getting moved to areas where they are likely going to get trips picked up. And it's in their best interest, right? They want to make sure that they're getting as many trips as possible. And so if there's scooters that are parked, sort of in more residential neighborhoods where they're maybe less likely to get a trip, the companies will be more likely to come and move those, but they're required to move them every day. And then I think just to George's other point about the corrals and the parking overall. So we are following very similar guidelines that we follow for City Bike when it comes to where to put these corrals. So we're not putting any corrals on a sidewalk that's less than 15 feet wide. And in those instances, we would be putting them likely in the roadbed. So, again, understanding that there's like a lot to balance here, right? We don't want to, we know there's a lot of competition for the curb, for the sidewalk space. We don't want to be, getting in the way of other activities. We also don't want to have no corrals where things are kind of all over the place and it's less organized. So trying to find that middle ground and understanding that it's a pilot. We're going to really understand what works, what doesn't work, and make changes accordingly.
Chris, do we have any other questions?
I raised my hand. I
Oh,
don't
yeah, sorry. Laura, your hand was up and then down, and then James
Oh, yeah,
Ross.
you know what? I was
is also
experimenting here. I'll make sure I'm doing it. Thank you. I just have a few quick questions. First, in case of injury, are these vehicles insured? Injury by the person riding it, injury by a pedestrian? How is that handled?
Yes. So the companies have pretty high insurance requirements, and that's also part of why we've been really keen to make sure that they do not have binding arbitration or class action waivers. So they are insured, and we're maintaining the user's right to sue the company if there's an issue involving a vehicle and a crash.
Thank you. You mentioned that sometimes you put signals on a roadbed if the sidewalk is narrow for returning. Does this program ever interfere with parking then?
Yes, so so this is showing the photo of what a corral on a roadbed would look like. So the roadbed corrals are about 20 feet long, which is about 1 parking space. The ones on the sidewalk will be a little bit shorter, about 15 feet. We have tried as much as possible. I would say the majority of corrals are on the sidewalk. The percentage, those that are in the roadbed, we've tried wherever possible to put them in places where you already were not able to park. So, for instance, around an intersection where maybe parking had been removed to enhance visibility, or other areas like that. So there are some places where parking is impacted, but we've really tried to minimize that as much as possible, understanding that of course is a concern for folks.
Huge concern. Another question, I'm sorry. You mentioned about community reporting. Does that mean there'll be very visible large license plates? For example, I'm on a sidewalk, somebody almost runs me over. How will I identify that rider?
Yeah, that's a great question.
Big and not something that's implanted there for you to go out, see a phone number, something big to identify. How do you handle that?
Yeah, it's a really good question. So, of course, if the vehicle is parked in an incorrect place, it's easier to walk up, see what's what, get the number right. But if someone rides by on the sidewalk, or you see 2 people riding on 1 scooter, which is not allowed, whatever you want to report it. All the scooters have onboard computers with GPS in them. So if you're able to call and say, hey, I'm in front of, the CVS, the Duane Reade on this intersection. I just saw a scooter go by. They will hopefully be able to match to say, okay, well, you're describing this incident at this location. And because of the GPS on the scooter, will know, okay, this is the user that was just at that location. And so then they can go to that user and either, depending on what the situation is, go through the sort of rider accountability policy and say, we had a report that you were riding on the sidewalk at this location. So, and again, depending on the accountability policy, either give that person a warning or potentially suspend or remove them from the platform.
All right, I do recommend some kind of large license plate, because if I was almost run over by something like this, I might not even have a phone number to call right then and there, because I don't know your phone number. but I saw some numbers on a bike. So I really, I really suggest you go beyond the GPS and you have some kind of license plate
They
type of
do
thing.
have a license plate type ID, vehicle ID on them, and it will probably vary slightly from vehicle to vehicle type about where exactly it is. But also, if you're able or someone near you is able to snap a photo, that's another great way to help identify.
Thank you. Last question. Is there some kind of auditory warning? Bells, is that part of the training? Because we've all been yelled at by bicyclists, get the blank out of the way. I think is a very common thing. And I say, I wish they'd use bells because believe me, I would like to move out of the way. You're equipped with some kind of auditory warning for?
Yes, all the vehicles have bells on them, and then they also have lights that are on 24/7.
Okay, thank you. Thank you.
Thank you.
We do have a few more.
Mhm.
James Rouse from our office, Director of Planning and Development. James, go ahead.
Hey, thanks, Chris. And thanks for the presentation. I did miss some of it, so if my question was addressed in any way, apologize. So White Plains Road is going to see a rollout with this, but at the same time, there's also going to be an installation of the bike lane, moving of parking spaces. How is that going to be coordinated in terms of timing? And I'm a little concerned about the potential for interference with bicycle parking. With scooter parking adjacent to a bike lane without any actual physical protective measures. Because if a scooter is improperly parked, it could be hanging out into a bike lane, or it could be knocked over given their size, whether intentional or due to weather. So the last thing we want to do is have a cyclist, going down quick, someone on a scooter quickly cutting across the park, and someone who's still trying to get used to the new parking lanes, all converge at once. So how will that be rolled out?
Yeah, a lot going on. So I believe that the vast majority of the corrals we've cited on White Plains Road are on the sidewalk, and then there are a few that are in the roadbed that are actually right at the intersection, but on the side street. And we've been coordinating closely with the group that's working on that project to make sure that we're not putting anything down that then they're going to come in and rip out, the month after us, or vice versa. So we have been coordinating with them. I don't think that there should be much of an impact on their project. And as I mentioned, most of the corrals on White Plains Road are going to be on the sidewalk. So that issue of crossing the bike lane or having an improperly parked scooter blocking the bike lane hopefully will not be too much of an issue.
Yeah, I just hope there won't be any interference, since the bike lane will be adjacent to some of these parking bays. Just making sure that whatever furniture is actually there is protective enough for any, bike or pedestrian or whoever is utilizing that space, because there will be people parking who will be walking across the bike lane and probably past these parking bays as well.
Thank you, James. Any other questions?
Yeah, Ken has his hand raised. So Ken, go ahead.
There we go. Thank you. You said that there is a schedule for the rollout in phases 1 and 2. Is there any schedule for a rollout after that, in particular, in my district? That's one. The other question is, are there any density requirements for the corrals that are set up? Like, is there a minimum or maximum distance between corrals? And any consideration for the density of commercial activity that's happening where there's a potential corral, because,
Yeah, so first for the service area, so this pilot has a max of 2 years based on the local law passed by City Council. So at the end of that 2-year period, we will be evaluating the program, evaluating the operators, and then determining the best course of action, whether to continue with the shared scooter program, expand it. There's been a lot of change and turnover in this industry in the past couple of years. So in 2 years, things could look very different from how they do now in terms of who's operating scooters, if there's new forms of vehicles that become very popular. So we are sort of waiting to see what happens with this pilot in the next 2 years before making any determination about what comes next. And then in terms of the corrals, so we identified these initial areas to have corrals with the Bronx Borough Commissioner's Office at DOT, thinking about where people might want to ride scooters and also where there's already a lot of sidewalk activity, already a lot of activity, and we want to try to really bring some order and organization to the parking structure. So to that end, where we are having corrals, we do want there to be a very high density of corrals. We want it to be, so with City Bike, which you may be familiar with, we want to always have a station within a 3 to 5 minute walk when you're in the service area. We've sort of amped that up a little bit for the Scooter Pilot so that if you are in a corral zone, basically there's a corral every intersection so that it's extremely easy to find one. We're really encouraging people, making it so easy to park in a corral that we're discouraging any bad user behavior. So we have been working again with the Bronx Borough Commissioner's Office to make sure that we have that high density of corrals, and we'll be evaluating sort of how the trip patterns as well as the usage at each corral. So maybe there's an area where the corral is always full, there's a lot of demand, maybe that's an area we need more corrals, and vice versa. Maybe there's places where we don't actually need as many corrals, but we're really trying to be overly cautious and make sure that we are limiting the sidewalk clutter as much as possible at the beginning.
Okay,
All
thank
right.
you.
And I see George put his hand back up. George, did you have a follow-up question?
I did. You mentioned something, and it occurred to me, especially in regards to James' question regarding the bike lanes in White Plains Road that are supposed to be installed. We don't want people riding the scooters on sidewalks, correct?
That's correct. So you're not allowed to ride on the sidewalk.
Okay. But in situations like White Plains Road and maybe Westchester Avenue and other places that have elevated trains, we don't have bike lanes there. People might feel safer. But if you're putting, because if I may be confused, I'm sorry, I wear hearing aids, so I probably didn't hear it properly. Are you suggesting that the bike corrals on White Plains are going to be on the sidewalk?
Yes, so and Jesse has been putting the links to some of our maps in the chat. We'll also circulate this, which we have the corral locations that we presented at all of the community boards. Yes, so a scooter rider is not permitted to ride on the sidewalk. Similarly to how a bicycle rider is not permitted to ride on the sidewalk if you're over the age of 12 or 13. But so on the instance of White Plains Road, users would be riding in the roadway. And then if to park in a corral on the sidewalk, you would, first of all, we've placed most of the corrals right at the intersection. So you wouldn't need to go down into the middle of the block. But you should stop riding the scooter and just push it to the corral to park it in that sidewalk corral.
All right. My only other thing is I also understood, and maybe it's just a nuance of the language. We didn't want the scooters being ridden in parks, right?
So we've been working with the Parks Department and really understanding what they're looking for in terms of requirements. So in terms of the smaller like neighborhood parks, you won't be able to ride. Those will be no ride zones. So again, the motor will cut off if you try to ride into a smaller neighborhood park. But we're working with them on areas like Pelham Bay Park to make sure that, you know, people can access things like Orchard Beach and other big destinations using the greenways and other bike paths.
Well, so I live in Co-op City. I can imagine that some people, especially if you have these scooters at the Pelham Bay train station, the only way to get to Co-op City would be to take the highway or through the parks system. So but the park system, for example, Mike Benedetto affectionately calls them the chicken coops. There are two bridges that go to Co-op City that have green, wire fence those are pedestrian bridges, but I've seen multiple scooters go through that. So I'm just curious in a situation like that, I don't want the motor dying while I'm trying to get home to Section 5, from the Pelham Bay train station. You don't have that situation going to Orchard Beach because you don't have to take the chicken coops. But the chicken coops are on 95. You can see them because they run along 95. Those are the easiest ways to get to Co-op City, other than hopping on the highway. Because we don't want people also hopping on interstate highways, right, with these scooters?
Absolutely not. So the highways will be no ride zones as well. So you wouldn't be able to get onto a highway. And again, sort of similar, like the rules that relate to scooters are similar to the rules that relate to bicycles. So you also can't ride your bike on 95.
Okay.
So yeah, that's a good question about the Co-op City access. I'm not as familiar with the specific locations, but I think that's something that we can look into, the sort of the access points a bit more. And I think we're scheduled to meet with the folks from Co-op City soon, so we can look into that a bit more.
Right, and again, the only thing I witnessed this yesterday. We have a problem here in the Bronx with kids riding motorbikes. I know that this might be an apples and oranges comparison, but for example, what I witnessed yesterday, and I've seen this with just regular delivery people as well. The kids that ride the motor scooters, maybe they just do it to be particularly annoying, but they frequently ride on the sidewalk, annoying and scaring the bejesus out of the pedestrians who are on the sidewalks. Which is annoying, and then I get the complaints about it. So again, I know that you say that these things are right on the intersections, these corrals, but again, there's a particular arrogance for even bike riders, regular people who on regular foot pedaled, especially in Manhattan, where it's almost a sport to mow down people. I don't want that similar thing happening here. And to Laura's point, about identifying bad operators, we can't do it with the motorbikes, but this is something that we're actually sanctioning. There should be some better way to identify bad operators. I know people will make the phone calls, and hopefully with the GPS they'll be able to tag people that are the bad operators. But I've frequently seen people riding their motorbikes, their delivery scooters on sidewalks because it's more convenient than driving down White Plains Road. There's less people on the sidewalk, so there's less traffic for them. I don't know if there's a way to immobilize these vehicles the same way that you have these sort of zones where you can cut off the engine, but we really need to discourage the use of these electric scooters on sidewalks.
Yeah, no, I totally agree. We really don't want people riding on the sidewalks. We do think that the combination of the community reporting, the GPS, and the rider accountability policies will hopefully all be good tools. And if it turns out that that those things aren't enough, then we'll come back and take a much closer look. I think the question about can we sort of have a motor cut off on the sidewalk is sort of one of the challenges around how accurate the GPS and onboard computers can be. So to date, we haven't seen one of these companies really be able to distinguish with that level of granularity around, are you on the sidewalk versus on the roadbed? So hopefully we're working towards that, but unfortunately that technology is just not as fine-tuned yet.
I want to jump in a little bit. Chris, are there any other hands up?
Nope, nobody
Unless-
else.
I have one question. I don't know if you can see my hand is up. Okay, I just see a conflict regarding the sidewalk corrals. There are sidewalks that you could hardly walk on now because of the open restaurants program. Yesterday, I was right at the border between Community Board 7 and 8 at the Target over there in Marble Hill. Because of the restaurants, you could hardly, it was such a crowded sidewalk anyway. And now you have Marshalls and Target there. I just see a real problem with the corrals, having a conflict with the open restaurants program, to be able to use those sidewalks. Also, I think that you need to be really careful about losing parking spots because every community is being asked because of electric car charging stations to give up parking spots. It's like we're in a parking desert in many parts of the Bronx. So I think that that's a serious consideration. I just wanted to talk about that conflict because of the open restaurants on sidewalks to be aware.
Absolutely. Yeah, that's something that we've been very aware of as we've been citing potential corral locations and looking at what the land use is, what's the business. Of course, do they already have an open restaurant? Is it a restaurant? Do we think they may
Right, and they could be in the street. And so where are you going to put the corral or how they're going to ride? Because they're way out in the street as well, so.
Right. So for the most part, we have really avoided any siting in front of any restaurant that either that has or may have outdoor dining. So there's probably some restaurants, but more like a fast food chain, something like that, that are less likely to have open restaurants. So we have really looked at what is the land use and really trying to get ahead of any of those potential conflicts.
All right, thank you.
Okay, Chris, again, any questions other than my own?
Nope, I don't see any additional hands raised.
Okay, so I just wanted to say that, for example, we're talking about the placement of the bikes and the potential for bikes being, well, I'm saying bikes, but scooters, to be ridden in a reckless way. And I guess I'm a little bit uncomfortable with hopefully this is going to be enough in terms of reporting. I mean, if I'm almost hit in front of, the McDonald's or the corner or whatever, and if by chance I happen to make a phone call, there's just absolutely not a reliable way to communicate this information. And even if by chance I have that number, we're New Yorkers. We're not going to sit for 30 minutes on the phone to try to evaluate what just happened. I think that would, even though this is a pilot, this needs to be worked out better, because this is obviously something that will happen and needs to be a more efficient way of getting this process worked through. And it just seems like I'm not hearing that is a priority. So from my point of view, I'm thinking this needs to be a priority. When there are issues, how to get them resolved more quickly. The issue of having bikes out of place. 24 hours doesn't sound like a lot, but if you're in the community and you have 6 or 8 bikes in the community, it really attributes to issues of quality of life. What does it look like when you have 6 or X scooters out of place? And there's my there are some things that seem, counterintuitive, not being able to use the bike at night, as opposed to, that's probably when you're going to need to use it the most in different parts of the Bronx, and getting cut off, at a certain place. It seems like those are going to create bigger issues. So I just feel that this conversation can be taken back or be the most useful if we are saying, okay, the solution is X, Y, or Z, and I'm not hearing that.
Yeah, so I guess, well, one thing I'll say is you can ride the vehicles at night. The only restriction is if you're a first-time user, that we don't want people to be leaving a bar or restaurant at like midnight and decide this is the time they want to take their first trip.
But that's exactly when someone might want to
but we
take
want
their
to make
first
sure
trip.
that people
They
we
might say
really
to themselves, okay, I don't want to walk this particular stint at night, particularly, maybe the bus isn't running the way it normally does or whatever. I'm going to pick up a scooter now. So now's the exact perfect time for someone to start a use of a scooter, especially if it's just right there.
So
And
yeah,
now you can't. Now that's not an option. So that's
So
counterintuitive.
it's not that
to the
it's not
purpose.
that your first this is like your first ever 30-minute
Yes,
trip,
that's what I.
right?
Yeah, that's what I said.
Right. So safety is really our number one priority, both for users and for non-users. And so I'll get to your other point in a second. But what we've learned from other cities is that the more severe crashes and fatalities that have happened on these vehicles tend to happen overnight and by new users. So we're really trying to ensure that people understand how to use the vehicle safely before they get on their first trip. And so we're trying to see what are the safety patterns in other cities and how can we create a really safe system. So that's why we have that restriction in place. And I think we feel very strongly about ensuring user safety. So
It's like using statistics to evaluate something, but not really understanding what the narrative might be around using it. So yes, you might have the numbers that say first time users, negative results, at night users negative results, but we're in New York, so this is a completely different animal than somewhere else. And if you decide that you need a scooter, maybe the first time you need the scooter is at night.
Right. And again, I think we have all these different safety protocols in place because that's our top priority. And so if you go to one of the safety demonstrations and trainings, you get a free helmet. Like there's a lot of incentives for people to take advantage of these safety offerings before they take their first trip. So again, I think we are really trying to learn from what we've seen with other programs in our city and other places. We want to take advantage of the fact that there is a lot to learn from other places, even if they are different from New York, because we would rather have a safe program where people have to take a safety lesson, and maybe that means they can't take their first trip at midnight when they're leaving the bar, but that's I think that's a trade-off that we are willing to make because
I'm
we
thinking
feel so
midnight
strongly
when they
about the
leave
safety
their
piece.
shift at work, and they decide that this is somewhere that they can use to get to their home. If again there's another type of service, transportation disruption, now I can use the scooter. So I think I think the narrative that you're portraying makes sense. And when you hear from other places that in a social area, someone leaves the bar and they decide, hey guys, let's get on a scooter, and that leads to a negative result. But again, this is New York, and we're not talking about, I don't know, Miami or some beach community or something like that. So that's why I'm not meaning this to be an entire debate on the merits of what you're saying, but just to express that there are different circumstances, and bringing a narrative from a different area is not as effective, and actually leads to some things that, to New Yorkers are pretty counterintuitive, some of which I named, and others I have not. So, we don't really, have to debate the issue if, as I said, these things are taken back and considered as ways to tweak the pilot. But I'm not hearing that. Again, I hear that, this is working, and this is where we're going to continue with it without any particular input. So that again is unfortunate.
No, happy to take your feedback and discuss it internally. I think this is a pilot, it's a learning experience. We're trying to evaluate a lot of different things throughout the pilot, from how people use these scooters to how the companies differ, how the vehicles differ. There's a lot that we're looking at. We expect to be making changes throughout the course of the pilot, and to be meeting with, coming back to you, to other stakeholders throughout the course of the pilot, and making adjustments as we need to.
Chris, do we have any other questions?
No, I don't see any other hands raised.
Okay. Can we unshare the screen?
Yeah, we're good.
Thank you. Thank you for your presentation. I think that there was obviously a lot of information there, and I think it was very helpful for us to understand the program as it stands. Thank you again. Thank you to Department of Transportation. Now we just move on to our the part of the agenda where we talk announcements. So I know we have a few people on that may want to make announcements. So if we could just unmute yourself or raise your hand and wait to be acknowledged by myself or Chris, then we'll give you a chance to make your announcements. Oh, while we're waiting for that, I should note that we have a district manager from Community Board 11 on, and also we have a representative from Council Member Riley's office on. Any hands?
Not yet. Michael Sharp from Finance, are you there? I know you mentioned earlier that you had some updates.
Did we lose him?
Not sure. Still connected.
Okay.
Oh, there we go.
Still here. Have to raise the volume a little bit. As always, good to be with you today. I just want to make just two brief announcements. One, we're always encouraging individuals to encourage your constituent or community board members to take advantage of the homeowner exemptions and the rent freeze program. But we also wanted to make you aware of something. We are trying a pilot here in the Bronx where we are doing outreach with community boards. Today, we'll do our first event with community boards 3 and 6, where we'll present information regarding rent freeze, because there are many people that are in danger of losing the benefit. And I've spoken to many of you offline about this. What we hope to do is combine 2 community boards together and then present information across both community boards. And in this way, even if we just did 1 per week, we can get a unified message across the Bronx in a little over a month. As a pilot, we're thinking of having 3 and 6 together, maybe 2 and 9, 4 and 5, maybe 7 and 8, 11 and 12. Of course, all of this is voluntary. It's depending on the interest and the needs at the community board. But we wanted to make you aware of that. You'll be hearing more from me as far as your interest in this and you're wanting to be involved with it. But by all means, I'm going to put a link in the chat for if anyone wants to join today's meeting. It's a link to our website where you can download the link and everything like that. So we look forward to working with you with this sort of, I guess you can call it an outreach pilot, and hope to be able to work a little more closely with you in a little more strategic way in the Bronx going forward.
All right. I don't see any other hands raised at the moment.
Okay, well, I guess if there are no other hands raised, then we have no more meeting. So I always thank everyone for being here. It's truly a pleasure to serve and serve with you. And thank all of our presenters today. We are vigorous supporters of the Bronx, and so we have always our interests are in the Bronx, and so we're always asking lots of questions and getting lots of information for everyone and here. So we thank you for coming and giving us that information. And you know, being that we're not we don't have any more announcements, it's the end of the meeting, and I thank you all for coming.
Have a great day.
Namaste.
Have a great holiday weekend, Madam Deputy. Take care.
Yes, yes,
Take
yes.
care.
Everyone have a great holiday weekend.
Yes.
Take care, man.